increasing quality of care and billings? Is this even possible? Hopefully it's possible that if we give better care, we should get paid more. Now, I got pulled up by my practice manager and he said, Tom, your billings are shit. Billings no good. You are $600 a day billing less than the rest of the practitioners. And I'm like, what? He's like, yep. Now, the plans are in, but something was going wrong. So we pulled the numbers and I then went through and there's a bunch of numbers that I'm not using. Now, some of those I'm not going to use. I have no interest in skincare. So all of those are gone. And then a lot of the antenatal care. I don't do many antenatal visits or antenatal care sessions. So they're out. And I went through and the rest of them pretty reasonable. 23, 36, 44, occasional, not much. 721, 723, 732, 2715, 2712. Pretty standard. Maybe a pregnancy test here. But there were a couple that stood out. And the interesting thing about these were that these typically could be provided by other staff members, not by my time. And a little light bulb went on. I went, oh, hang on, maybe this is what's going on. Do you know the numbers? I'm sure you do, if you're in the game. Health assessments? Yes. Then follow-up phone calls? Yes. ABIs in patients who have that indication. ECGs, again, when indicated. Spiros, if you can meet the new guidelines. Our practice gave up on spiros. It's too hard to actually make them viable on the bulk billing, so no more spiros. You have to go see the respiratory physician for that now. But those numbers were missing from my billings. I'm like, okay, this is clearly a problem, not only for my bank account, and perhaps your bank account if you're not doing that, but also for our patients. Government has said, hey, do these things. Presumably, they didn't just pull them out of thin air. They actually went, you know what, these things make a difference. If we get health assessments done, it keeps people out of hospital, it costs the overall society less. Let's pay the GPs more to do these health assessments, and we will have happier patients. Now, this, though, raises a number of issues. First of all, who needs them? Identifying those patients, making sure that they're on the list is the first thing. And then making sure that if they are on the list, that they get done. Now, both of these require, if they're going to be done consistently, require systems. A system to work out who is eligible, a system to work out who has had it done and needs it again in a certain time frame, system for letting the patients know the value of these and what to do, what to expect. Done well, with good systems, the patients are aware of why they are getting these things. The nurses know how to do them to extract and find the data and the information, identify what's been missed, and the practice and myself get paid, which is good. I have to look after these patients, and one of the major problems is just finding information. Now, having been around and done a few locums, I got to experience some of the other medical practice software. At the moment, we largely use Genie, but I'd had experience with medical director and best practice, and I'm like, okay, you guys aren't making this easy. Or perhaps I just didn't know what to do, wasn't trained on it. And not only was money left on the table, but also patients missed out on quality care. This is a problem. But this systematic approach of getting things done systematically, following the procedure so that the things get checked, what's going on, even the first system of identifying who is due for health assessments, who is due for a care plan that hasn't had one. These systems need to be executed on a schedule. Every month, run the system. What comes up? Who is already had theirs? Who hasn't had theirs? Then with those that are due, another system is required. It then gets triggered. It's like, okay, hey, letters get sent out. We just have the bone bus coming in October. And we managed to execute a system that pulled out all of those people who are eligible or who have had osteoporosis and send them letters. And then when they showed up, there was a further system that said, hey, give them this letter, tick the right boxes, and then we're set. All of these things got done. Now, was it magical? No. Could it be better? Absolutely. Absolutely. It would be extremely helpful that I could find those bits and pieces and find the instructions rather than getting lost in our task list. But nonetheless, the overall idea of this system worked. And we could execute it again. Now, the better your practice get and the better you get at systems, the better quality care your patients get, the more billings come through from Medicare, but also your value as a doctor goes up. You are preventing problems. And that is a very interesting game. Because if you can sell the prevention of problems, which is not that difficult, it happens all the time. Do you have insurance? If you do, then you are buying into the idea that you want to be protected. And health is worth protecting. It is so difficult to do anything on this planet if your body is not working. It really is. And you'll see your elderly patients get confined to a room and their life becomes that room. Now, could they still be powerful in that place? They could be. Absolutely. I had the pleasure of meeting Ram Dass, confined largely to one room. Occasionally would get down into the pool, occasionally go into town, but largely in one room. And in that place, whoo-wee, I got to spend about 2 or 3 minutes with that gentleman. Oh my goodness, what an experience. Even though he had had a stroke some 28 years ago, constant pain, his spiritual practices were so powerful. One of the defining moments of my life. It was that I was like, oh, wow. So it is possible. But for most, they're not doing too much. They're just confined to the room. So looking after health, making sure that people's bodies work, it's a powerful game that we are in. All right, that's all I got for you guys today. If you're interested in systems and how to do this stuff, then reach out to me at Dr Tom, GraduateMedicine.com. Otherwise, you go ahead and have a great day. See you next time.